CEN Test Prep Exam Day. Question 1. Murphy's sign is used to assess for Option A. Pancreatitis. Option B. Acute cholecystitis. Option C. Diverticulitis. Option D. Small bowel obstruction. The correct answer is option B. Acute cholecystitis. Question 2. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A. Pinpoint pupils and respiratory depression. Option B. Dry skin and absent bowel sounds. Option C. Hyperreflexia, clonus, and agitation. Option D. Bradycardia and hypotension. The correct answer is option C. Hyperreflexia, clonus, and agitation. Question 3. A Call's fracture involves the Option A. Proximal humerus. Option B. Distal radius. Option C. Femoral neck. Option D. Tibial plateau. The correct answer is option B. Distal radius. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient presents with cholinergic symptoms, salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis. This toxidrome is most likely caused by Option A. Anticholinergics. Option B. Sympathomimetics. Option C. Cholinergics, organophosphates. Option D. Opioids. The correct answer is option C. Cholinergics, organophosphates. Question 5. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A. Patch both eyes. Option B. Immediate copious irrigation with water or normal saline. Option C. Administer topical antibiotic drops. Option D. Perform a visual acuity test. The correct answer is option B. Immediate copious irrigation with water or normal saline. Question 6. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A. Encourage early ambulation. Option B. Keep the patient NPO and provide aggressive fluid resuscitation. Option C. Administer high-fat diet. Option D. Restrict all 4 fluids. The correct answer is option B. Keep the patient NPO and provide aggressive fluid resuscitation. Question 7. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects Option A. Open-angle glaucoma. Option B. Acute angle-closure glaucoma. Option C. Conjunctivitis. Option D. Uveitis. The correct answer is option B. Acute angle-closure glaucoma. Question 8. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to Option A. Administer oxygen. Option B. Place the patient in Trendelenburg position. Option C. Immediately discontinue the procedure. Option D. Assess vital signs. The correct answer is option C. Immediately discontinue the procedure. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A. Administer amiodarone 300 mg for push. Option B. A synchronized cardioversion at 100 J. Option C. Immediate high-quality CPR and defibrillation. Option D. A transcutaneous pacing. The correct answer is option C. Immediate high-quality CPR and defibrillation. Question 10. The most common cause of lower gastrointestinal bleeding in adults is Option A. Gastric ulcer. Option B. Diverticulosis. Option C. Esophageal varices. Option D. Mallory-Weiss-Tear. The correct answer is option B. Diverticulosis. Question 11. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of Option A. Acute glaucoma. Option B. Retinal detachment. Option C. Corneal abrasion. Option D. Cataract. The correct answer is option B. Retinal detachment. Question 12. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates option A. Normal cellular metabolism. Option B. Hypoperfusion and anaerobic metabolism. Option C. Kidney failure. Option D. Liver failure. The correct answer is option B. Hypoperfusion and anaerobic metabolism. Question 13. Pulsus paradocus is a classic finding in which condition? Option A. Cardiac tamponade. Option B. Pulmonary embolism. Option C. Aortic aneurysm. Option D. Congestive heart failure. The correct answer is option A. Cardiac tamponade. Question 14. Which pupil finding is associated with uncal herniation? Option A. Pinpoint, non-reactive pupils. Option B. A unilaterally dilated and fixed pupil. Option C. Bilateral mid- position and fixed pupils. Option D. A constricted, sluggishly reactive pupils. The correct answer is option B. A unilaterally dilated and fixed pupil. Question 15. Meningitis is an inflammation of the option A. A brain parenchyma. Option B. Meninges covering the brain and spinal cord. Option C. Peripheral nerves. Option D. A ventricles of the brain. The correct answer is option B. Meninges covering the brain and spinal cord. Question 16. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A. Restrain the patient firmly. Option B. Insert a bite block. Option C. Maintain airway and administer benzodiazepines as ordered. Option D. Obtain a STAT CT scan. The correct answer is option C. Maintain airway and administer benzodiazepines as ordered. Question 17. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is option A. Forcing oral fluids. Option B. Straining all urine. Option C. Pain management. Option D. Surgical consultation. The correct answer is option C. Pain management. Question 18. A patient with a spinal cord injury at T1 is bradycardic and hypotensive. This is characteristic of option A. Hemorrhagic shock. Option B. Cardiogenic shock. Option C. Neurogenic shock. Option D. Septic shock. The correct answer is option C. Neurogenic shock. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to option A. Patients with private insurance only. Option B. Any person who comes to the ED and requests care. Option C. U.S. citizens only. Option D. Patients with urgent conditions only. The correct answer is option B. Any person who comes to the ED and requests care. Question 20. What is the priority intervention for a patient with an open fracture? Option A. Immediate surgical debridement. Option B. Apply traction. Option C. Cover the wound with a sterile saline-moistened dressing and immobilize. Option D. Administer analgesics. The correct answer is option C. Cover the wound with a sterile saline-moistened dressing and immobilize. Question 21. The most critical treatment for a patient with heat stroke is option A. Oral rehydration with electrolyte solution. Option B. Rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Option C. Administration of antipyretics. Option D. Active external revarming. The correct answer is option B. Rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Question 22. The antidote for acetaminophen overdose is option A naloxone, option B N-acetylcysteine, option C flumazenol, option D sodium bicarbonate. The correct answer is option B, N-acetylcysteine. Question 23. Which of the following is an early, compensatory sign of shock? Option A anuria, option B metabolic acidosis, option C tachycardia, option D unconsciousness. The correct answer is option C, tachycardia. Question 24. A patient presents with sudden onset worst headache of my life. The nurse's first priority is option A administer pain medication, option B perform a complete neurological assessment, option C prepare for lumbar puncture, option D obtain a non-contrast CT scan of the head. The correct answer is option D, obtain a non-contrast CT scan of the head. Question 25. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects option A cystitis, option B pyelonephritis, option C nephrolithiasis, option D renal artery stenosis. The correct answer is option B, pyelonephritis.